Okay, hello everybody. So my name is Ursula Marinelli, and I am the Coastal Foundations Director overseeing the Samaritan Foundations in Newport and Lincoln City. I'd like to welcome you to our MedTalk today, and it is sponsored by Sharon Beausoleil and Sigma Alpha Epsilon OSU Fraternity. Before we begin our presentation, I wanted to give you some context for today's theme, Lead a Legacy of Generosity. As some of you know, the Samaritan Foundations in Albany, Corvallis, Lebanon, Lincoln City, and Newport launched our ever system-wide comprehensive campaign in 2021. It's a $35 million campaign over 5 years called Stronger Together and features local and regional initiatives. The campaign theme, Stronger Together, illustrates the collective impact that donors to the 5 foundations are making in support of Samaritan's mission, building healthier communities together. Stronger Together's framework consists of 4 themes. These themes build upon past successes, highlight organizational and community pride points, embody our shared values, and represent a vision for the health and well-being of our entire region. This framework holds the projects, programs, and initiatives that our local stakeholders have identified as top priorities. Those are listed here, to ensure the highest quality healthcare for patients and to address the social determinants of health for people living in Lynn, Benton, and Lincoln counties. First, we improve access to care through enhanced services and technology in rural settings. Next, we inspire hope by supporting patients to help ensure everyone gets the care they need, including innovative approaches to enhance behavioral health services. Third, we build community through early interventions, expanded care for vulnerable patients in and outside of clinical settings, and collaborative approaches to address complex community health needs. And finally, we extend opportunities for local donors to leave a legacy of generosity by inviting support that will impact the future of healthcare through scholarships, endowments, and research endeavors. I'll kick off today's topic with a brief story. This is Birdie Williams. In 1947, Ms. Williams donated the first $1,000 to fund what eventually became the original Pacific Communities Hospital in Newport. I've asked around to see if anyone knew Birdie Williams and have yet to meet someone who did. But still, everyone who lives in this community benefits from what she started. That's a legacy of generosity. When we were educating the community in 2015 about the bond measure to expand Samaritan Pacific Communities Hospital and create the beautiful facility that it is today, Don Davis, Newport City Manager between 1962 and 1991, said this: "Our hospital exists because of community support dating back to the 1940s when a group of concerned citizens organized to build its first medical facility. Ever since, each generation has played a key role in enhancing our hospital to meet ever-changing healthcare needs. We stand on their shoulders, and it is our turn to step up for ourselves and for future generations." Don Davis was talking about people like Birdie Williams, who I'm sure contributed to the fund so that she and her loved ones could benefit. But in doing so, she improved the quality of life for not only her contemporaries, but also for future generations, helping to make Newport a vibrant, livable community. And I am grateful that she did. Today, you'll hear other stories about people, some of whom you may actually know, who have intentionally chosen to lead a legacy of generosity through estate planning. That could mean leaving a Samaritan Foundation in their will or trust, creating a charitable gift annuity or a charitable remainder trust so that they receive an income for life along with the tax advantages of making a gift during their lifetimes, or naming the foundation as a beneficiary of an insurance policy or financial account, which is something that I have chosen to do. I have a daughter and a partner who will benefit from my estate when I'm gone. My daughter is currently 27, but this is still how I see her. But I named the foundation a partial beneficiary of one of my taxable IRAs because I know that the foundation will not have to pay income tax on it as my loved ones would. Since the foundation receives gifts tax-free, the benefits of that account are maximized. My family will still be taken care of, but because I stand on the shoulders of people like Birdie Williams, I chose to pay it forward and help ensure future generations enjoy the same great health care that my loved ones and I do. Over the next hour, you'll hear 4 more legacy stories from the Foundation's team, who you'll be introduced to along the way. We'll also share some information about free estate planning tools available on our website, as well as the benefits associated with joining the Samaritan Legacy Society. So on that note, I will turn the floor over to Brandy O'Bannon, Executive Director of the Lebanon Community Hospital Foundation.
Thanks, Ursula, and good afternoon, everyone. I want to share a story with you. The Lebanon Community Hospital Foundation received a generous estate gift from a donor in 2021 that established a scholarship for East Linn County residents who want to pursue a medical degree from either Western University in Lebanon or Oregon Health Science University in Portland. The scholarship program is designed to help residents of the Brownsville, Cascadia, Crabtree, Crawfordsville, Foster, Halsey, Lacombe, Lebanon, Scioto, Shedd, Sweet Home, Tangent, and Waterloo communities who are attending medical school. The donor gave annually to our foundation for over 20 years, and staff had discussed the scholarship opportunity with her several times at her request over the years. However, we never received confirmation of the details of her estate plan until after her death, and when we received a generous gift endowing the scholarship, it was a beautiful and wonderful surprise. The donor, whose photo you see there on the screen, Julietta Pate, graduated from Lebanon High School. She received a bachelor's degree from Oregon State College and a master's degree from the University of Oregon. She taught elementary and middle school for many years, mainly in the Corvallis area. I had the honor of meeting Julietta once before she passed away. In her early 90s, she had seen many changes in East Linn County during her lifetime. I'll always remember a story she told me about attending a one-room schoolhouse in the community of Crowfoot. Outside that school was a sign that read, "To educate is to elevate." I think this is a perfect motto for Julietta's life, as she pursued higher education at a time when that was not overly common for women, particularly from rural areas. She devoted her life to learning and inspiring youth to pursue their own dreams. Julia was unmarried, she did not have any children, and she did not have many living family members. She was a lifetime member of a local church, and through prudent financial planning and investing, created a scholarship which carries on her name and will benefit generations of students. Julietta's generosity continues as the Lebanon Community Hospital Foundation continues to receive generous ongoing annual gifts from her donor-advised fund to support our local hospital and area clinics. Through Julietta's estate plan, she was able to honor her values, her belief in the power of education to transform lives, and continue to invest in one of her favorite local charities, our Lebanon Community Hospital Foundation, where her funds are supporting equipment purchases and enhancing patient care. Friends of Julietta serve on her scholarship committee, including a neighbor who knew her for decades and helped guide scholarship decisions. We are so very grateful for Julietta's decades-long involvement with our foundation and for helping create a legacy that will carry on for decades through her scholarship recipients. And now I'd like to invite my colleague, Leslie James, Associate Director of North Lincoln Hospital Foundation, to share.
Thank you, Brandy. Today, I am sharing a story of amazing timing. Just a few short years ago, it was determined that our 50-year-old wooden hospital needed to be replaced. Our health district and Samaritan Health Services came together to create a plan for a new hospital. The vision was to create a world-class, state-of-the-art facility that would challenge the conventional expectations and bring forward a new era of high-quality, patient-centered care in our small rural community of Lincoln City. Fundraising efforts began in earnest at the North Lincoln Hospital Foundation. We were tasked with raising $7.5 million for equipment and fixtures for the new facility. Quite a big lift for our little foundation. Building a new hospital was critical for the continuation of health, the services, and welfare of our community. Keeping services local has always been a top priority. We received small donations, large donations, substantial donations, and grants. But just when we needed it most, we received the most amazing news. We learned that one of our longtime donors, Jacqueline Shank, a school teacher, had passed, leaving us an estate gift. Not too many months later, we were learned to receive another estate gift from William Nevis, a person of substantial wealth who had also passed, leaving a foundation in his will. Both Jackie and William were longtime community members and foundation donors. Both were very grateful for the wonderful care that they received at North Lincoln Hospital. As a result of that care, we received two very generous gifts from which were incidentally had no restrictions. The timing was amazing. It couldn't have been any better. The combined gifts were a significant amount. We were able to use them to pay for a large portion of the new cutting-edge equipment that our new hospital needed. At a critical time in our fundraising campaign, those gifts appeared in our mailbox. Today, Samaritan North Lincoln Hospital is not only one of the most technologically advanced hospitals in the state, its innovative design and the caring staff have come together to create an incredible center for healing and wellness. A very big part of bringing that vision into reality was the legacy gifts that both Jackie Shank and William Nevis left us. We hope this story will help inspire you to consider how your visions can come together with ours and create a better future. Now it's my pleasure to introduce the Executive Director of Good Samaritan Hospital Foundation, Darrel Kau.
Thank you, Leslie. So I want to share about a story that began last summer in 2021. I received a call from a woman who told me she was finalizing her parents' trust and she needed some information to process the gifts. We were a designated beneficiary. With many trusts, sometimes you don't really know exactly what to expect until you receive the gift, which is what happened in this case. After completing the required trust documents, I reviewed her parents' history with the foundation, and I found out that they had only made one modest donation in 2018, and their address was in Washington State. The mom was a retired nurse who previously worked at El Camino Hospital in Mountain View, California, and he was a retired United Airlines pilot. About 3 months later, a check showed up from the trust in the amount of $100,000. I was delighted and very grateful. Again, didn't know what to expect, and a $100,000 gift is fantastic. A few days later after that, I received a letter from the daughter I had spoken with, and she had shared that their parents were both patients at Good Samaritan Hospital, and they really appreciated the quality of care and experience they had. Her and her brother said that it would mean a great deal to them if we were able to support the areas of the hospital that impacted their parents. And what mattered most to them was cancer care and research or dementia care and research. Now, during the same time period, although the gift came in unrestricted, I had a meeting with our VP of Academic Affairs and the director of our Samaritan Research Program, and they had shared with me that they had a desire to remodel our library, and the library is located in the hospital next to our gift shop. They wanted to remodel to better serve our doctors and clinicians. Our current library is, the old school library with hard copy books and journals on shelves and a big, huge reference desk, which isn't being used. And they were interested in setting up the library so that they could utilize the space to increase our capacity to do more research. Currently, our research team is scattered throughout various locations, and we don't have a home center for this activity. They wanted to remove the book stacking units and allow space to accommodate research management center, and just as importantly is an area for the clinicians to meet in separate resource areas so that they can have discussions and talk about research studies and what they were working on and collaborate together. Their goal ultimately is to increase our research activity and create designated spaces, and this project would revamp our library for this purpose. Now, I shared with the family after learning about this project wish, and they said that I said we could honor their parents with a naming plaque in this new clinician resource and research area if it was appropriate. And any remaining additional funds we would put in our research fund, where the majority of our research is done in cancer and responsive clinical studies throughout the system at all 5 of our sites. I received an email response to my suggestion, and it said, "Thank you for your response. My parents were both well educated and my mom was a nurse, so we think the library is a great way to honor that. They both believed in continuing education, and knowing that we are helping healthcare professionals with that makes me smile." And that made me smile. Why I love this grateful patient story is that years ago, this couple who used to live in Corvallis had such a good experience at Good Sam. And although they had moved away, they still included the Good Samaritan Foundation in their planned giving. This is a common theme with bequests. They usually come from someone who has had a personal experience or relationship with the hospital, and they come from your average community member, like what we heard earlier with retired teachers or a nurse, or in this case, a retired pilot. They may have given modest donations during their lifetime, but were able to leave a legacy gift that has tremendous impact. Our role at the foundation is to ensure we honor each donor's intent of their gifts when they are living and when they have passed on. It is very rewarding to match donor interests with hospital needs, and in this case, fulfill family wishes to honor their parents through the foundation. Now I would like to introduce and welcome Bobby Williams, who's our Senior Development Specialist at Albany General Hospital Foundation.
Great, thank you, Darrel. As you have all heard, there are a variety of ways that planned gifts to one of the 5 Samaritan Foundations can have a lasting impact by improving access to care, building community, and inspiring hope. Each of our foundations have various endowments to support specific programs and services at the local hospital. Today, I would like to share with you a video that tells the story of Ken and Lorraine Carter, who left an estate gift of over $500,000 to the Hospice House Endowment, which was renamed the Carter Hospice House Endowment by the Albany General Hospital Foundation Board of Directors in honor of their generosity. The story began over 60 years ago with Lorraine's involvement as an Albany General Hospital auxiliary member, and then later as a board member of the Albany General Hospital Foundation, and continues today because of the legacy they have created in providing perpetual funding to support the Samaritan Evergreen Hospice House.
I knew Ken and Lorraine Carter from at age 5 in 1959. In thinking about the impact that Ken and Lorraine thought of their gifts, they did not really care that their names were involved, but that the assets that they left would be used, help the community, add to the vitality, to help particularly at the hospital and the hospice house. They were the neighborhood folks that didn't have any children. I worked for them after my college years and before I went to law school. From then on, I was a family friend, and they were like my second set of parents eventually. Ken and Lorraine became connected with the hospital all the way back to 1958 when Lorraine joined the hospital auxiliary, and she maintained that contact until the year 2014. Ken had some health issues in the 80s, and at the end of his life, he was taken care of by Evergreen Hospice. Ken passed away in 2004, prior to the hospice house being built. Ken and Lorraine had set up their trusts early on. Ken, in his legacy gifts, left assets to the help of children in the community and also to the hospital foundation to support scholarships. Lorraine added to her trust the legacy for the hospice house. And it was very important to her to see that through with the way that hospice had taken care of Ken. The last year of her life, she had some health issues. I sat with her for a while and told her we were going to bring her home to Albany to the hospice house, to her house. And she squeezed my hand, and we brought her back, and this is where she passed away. She knew she was in loving hands of some great people. And so leaving a legacy for them was a way to give back to the community and to help those organizations that they believed in.
This video, along with other incredible stories of legacy in our communities, can be found on the Samaritan Foundation's website at samhealth.org/giving. It is now my pleasure to introduce Karla Clem, Senior Development Specialist at the Pacific Communities Health District Foundation.
You've heard from these powerful stories from others whose shoulders we stand upon. If you're thinking about your own legacy, I'd like to share some ideas about things you can do today. You can visit our planned giving website at samhealth.giftlegacy.com, and I'll add that address into the chat. This website can help you organize your thoughts about not only what to give, but how to give. In the same place, you can gain access to our helpful estate planning guide, which is a great place to start if you're one of the people who doesn't yet have a will or trust, or if you just want to walk through the steps of updating a will or trust that you've had. On this website, you can also learn about and sign up for our Gift Legacy newsletter, and that shares helpful legislative updates. It shares educational articles and updates, and donor experiences that may be useful to you and give you some ideas. As you're considering what makes sense for you and your family, whether it be a bequest, a beneficiary designation, or a life income gift like a charitable gift annuity or a charitable remainder trust, think also about whether there is a person in your family who would appreciate your support of the foundation and being included in that relationship. And contact a foundation staff person to talk about what matters most to you, what your philanthropic goals are, and what your financial goals might be. As well, consider introducing us to some of your trusted professionals, such as your legal, accounting, or tax or insurance professionals, so that we can all work together to help you plan or blend your giving to maximize the legacy that you can make and that you can leave. In doing so, you would also be helping us to expand our network of professionals that all benefit our communities. Next slide, please. You can choose to become a member of Samaritan's Legacy Society by simply notifying us of your intention to include one or more of the Samaritan Foundations in your estate plans. While people at our hospitals and clinics do amazing things every day, we know that your support of our foundations is not because we are outstanding, but because you are, and we want to recognize you for that. When you notify us of your intentions, you'll be recognized in several ways. Next slide, please. Some of those ways include being invited to special events, such as our President's Society dinner, or being included in featured publications, such as our Heart to Heart magazine and our annual report. Your name will also be listed on digital displays throughout all 5 of our hospitals and on our website. And in some gifts, you can also have different naming opportunities, as we've heard from some of the legacy donors' stories previously. In addition, we remember our Samaritan Legacy Society members who have passed on each year in our annual Light Up a Life event. Next slide, please. Knowing your intentions also helps ensure that your gift is used to make a lasting impact in the areas that are most meaningful to you. You can choose to elevate others through education, as Julietta Pape did, for future generations of healthcare workers by providing scholarships. Or you could provide cutting-edge research, as the donor in Darrel's story shared. You can also impact areas of the greatest need, as they evolve in our rural communities, in the way that Shank and Nevis both did in their gifts to North Lincoln Hospital Foundation's unrestricted funds. Or you can choose to support an endowment to ensure that your gift that is most meaningful to you and to your family continues in perpetuity, as the Carters did. In whatever way you choose to create your own legacy of generosity, please know that it is our honor to help you, to exercise the tremendous power that you have, and to help make us stronger together. We thank you for your consideration. And now I'll turn things back to Ursula Marinelli.
Okay, so at this time, if anybody has questions or if you have a legacy story that you would like to share, we'd like to hear those now. I will say that that I filled out one of those intent forms, those letters of intent, just because I wanted to be sure that the foundation knew how I wanted my beneficiary gift to be used, and that's towards our general endowment. I was able to just go into my financial account and add the foundation as my beneficiary. That was simple enough to do, but I wanted to make sure that the foundation knew that I wanted it to go towards the endowment. So I filled out the form. You don't have to fill out everything on the form. It asked for the estimated dollar amount. It's really hard for me to say because I hopefully will live another 30 years. So it's impossible to know what that will be valued at in the next 30 years. So I just left that blank. So there, even if you inform us about a gift, an intended legacy gift, you don't have to include all of that information, anything that you don't feel is appropriate to include on that form, as long as we have a good understanding about how you want those dollars used and some sort of a contact for after we've passed. Brandy, you had shared recently about a news story that you had heard.
Sure, I'd be happy to share. Yeah. So similar to what Darrel shared as far as the impetus was a grateful patient at our hospital. So kind of the crux of it is that a patient during a recent stay, he had a rather lengthy stay at our hospital and was really inspired by the good care that he received from our nurses and doctors. And after many conversations, both at the hospital and once he's home, he decided both to make an estate gift and has since also made an annual gift to help with some equipment needs at the hospital. But many things inspired me about this particular family, but what I really appreciated is I think why he was at our hospital, he was reminded of his own parents' legacy and their history with our hospital and our foundation. So back in the 50s when Lebanon Hospital, our new site, was kind of created, there was a great kind of fund drive that happened in town, and many families contributed to that drive for the new hospital site. His family was one of those, and he was reminded of that in kind of a plaque that's at the hospital. So just again, we appreciate every donor who remembers the hospital and their foundation and their will or estate plan. But I thought that was an interesting story to share in terms of this particular family was reflecting on the generosity that they had seen kind of in their own family and those choices that they had made. And so that kind of re-inspired him that he was honoring his parents actually through his legacy gift as well, kind of continuing on their generational giving. So just thought that was kind of fun to share. And again, we so appreciate that opportunity to partner with that family.
Thank you, Brandy. Okay, before we wrap up, last call for questions. All right. So we hope the legacy.
Ursula, there is a question. Sorry, there is a question.
Oh, there is
Susan, in the chat, if the trust document states that the gift is unrestricted, can the letter of intent be more specific and changed perhaps without having to revise the trust?
That is an excellent question. And I think I have to say that would be a question for your attorney or the person who actually created the trust for you.
So I'll just respond for the story I shared today, Susan. It was unrestricted. It came to us unrestricted, but after meeting with the children and they shared about what their parents' interests were and what would mean the most. What we did was, although the funds went into an unrestricted board fund under the foundation, we went through a process through our finance committee. This might be too much information, but we went through a process of approval all the way up to the board of trustees to allocate and those funds toward that research project that I described today. So we were able to, because we had a need for it. So I think ideally you would want to have the specific language in your trust to be sure, but of course we would try to honor anything we could at that time. So not sure.
Yeah, Darrel, that's a really good point. Since it's stated as unrestricted, if your letter of intent was more specific, that would be a lot easier to be able to honor through a board vote, as Darrel said. If it were the other way around, it would be more complicated. If your trust said it had to go to the endowment and then your letter of intent said something different, that's when I think it could be a lot stickier. So hopefully that helps. I think a letter of intent clarifying where you would like it to go would be very helpful. Any other questions? I don't see anything else in the chat. All right. So as I started to say, we hope that the legacy stories you've heard today have helped you to understand the tremendous impact that estate giving has on the health of our communities. Estate gifts to the Samaritan Foundations have ranged between $10,000 and more than $1 million and everything in between. Over the years, 257 community members have made legacy gifts to the foundation, totaling close to $15 million, so that we can continue to fulfill our mission of building healthier communities together. We hope that today's presentation inspired you to think about your legacy, and we'll see you at the next Inspiring MedTalk when Samaritan Evergreen Hospice Director Karen Daly and Coast Manager Teresa Karla share building community about the compassionate services that Samaritan Evergreen Hospice provides to our communities in the Valley and on the coast. So thank you again for sharing your time with us today. In a week or so, you'll receive an email with a survey and a link to this recording. We value your feedback, so please complete the survey. We've all put our contact information in the chat, so feel free to reach out if you do think of other questions. And thank you, and have a wonderful day.